Hello, I'm Russ McLean, Chair of the Patient Voices Group, and today I've come along to the Royal Blackburn Teaching Hospital to speak to its Chief Executive Officer, Mr Kevin McGee. Kevin, hello.
Good afternoon, Russ.
I'd like to start, first of all, with some great news, I guess, for road users, and that is the news that the road from the M65 and the Grain Road end will in fact be being doubled in size. So that's got to be good news for ambulances, for your staff, particularly when they're coming to work and leaving work, but also for patients.
Absolutely. I mean, one of the biggest complaints that we have, both from staff and patients, is the amount of time it can take from the motorway through to the hospital. So anything that's going to improve that is really good news. And I'm delighted that the council and the local authorities have worked with us so closely to improve access.
Of course, it creates a lot of bottlenecks, particularly when people are going home from work and things. So I'm guessing it will be a win-win all round for everyone.
Oh, absolutely. For staff and for patients and for our communities, this is really good news.
Some of the complaints that I hear about are that staff are paying for monthly direct debits to park here and then still not being able to park. Are there any truth in the rumours you remember a while ago that there was discussion about a multi-level car park? Is that something that might still happen?
We're continuing to look at all options in terms of car parking. And you're absolutely right. There is never enough. You know, we have increased car parking, we've increased the spaces, but as we increase the spaces, and it's a good thing, we employ more staff. And so there's always seemed to be this pressure in terms of car parking. So we are looking at all options. One option may be to have some type of multi-storey, but it's only one of many options we're currently considering.
Now, charity, ELHT and Me is the hospital's own charity. Can I ask, first of all, how that's going?
It's going really well. I mean, one of the things that we noticed going back a number of years is there were lots of health charities looking for income within Pennine, Lancashire, but actually our own hospitals, we didn't really have an active charity. So we've set up ELHT and Me to really generate, additional funds, every penny of which goes back into patient services and providing the luxury in patient services.
Now, I suppose the good news for the charity's point of view is that recently Blackburn Rovers announced that it was to become one of their chosen charities for the year. So I guess that will make a considerable difference.
Oh, I'm sure it will. Clearly, we're delighted that Blackburn Rovers chose as its preferred charity for this year. That's really important too, as it brings that connection to the football team and to the local community, and we'll hope to generate significant additional income by being part of this joint venture.
Now, 30 years ago, obviously you weren't here at that time, the hospital launched a charity to raise funds for an MRI scanner, a £1 million scanner appeal, which was back then a heck of a lot of money. In fact, still a lot of money now if you haven't got it. Why are hospitals like yours having more and more to rely on charitable donations from members of the public to provide services at their hospitals?
Well, as you said, I mean, if you go back 30 years, it was happening then. So I don't think it's happening more and more. But if you think about a CT scanner 30 years ago, it was cutting-edge technology. Not many places had one. And that's very similar to what we're looking for now. We don't... A CT scanner now is every hospital will have one, and we wouldn't raise additional funds for that. But if there's anything cutting edge or there's anything luxurious that we might want to provide for our patients and our communities, we don't always have the budget for that, and so we would look to see whether we could raise funds for it. And what I'm convinced of, it's the right thing to do, because every penny we raise from our local communities goes back into services for looking after the local communities.
Do you know whether the charity ELHT and Me is on target? Do you know how much money has been raised?
I can't give you an exact figure, but what I can say is we're absolutely delighted with the amount of funds that has been raised and by the input from our local communities. As you said, we're the chosen charity for Blackburn Rovers, and things like that really raises the profile. And the population of Pennine, Lancashire are incredibly generous, and we are incredibly grateful for that, because it does allow us to provide those additional luxuries.
The Pennine Plan, Improving Health, Care and Wellbeing in Pennine, Lancashire, tells us that planning and delivering health and care across Pennine, Lancashire is complex and confusing for both professionals, patients and their families. This impacts our ability to provide excellent care and in many cases is financially unsustainable. So organisations who are responsible for delivering health and care services have agreed to work together. But Kevin, I guess the question from the member of the public is, if that's the case, what does all that mean, and why haven't you done it sooner?
So I can understand why it is complicated, and absolutely we should have done it sooner. But if you think about health and social care, there's a number of different health organisations. There's also different social care organisations. Some of it's in the health services, some of it's delivered by local government. And what we've recognised is by having all these different organisations and barriers, we're probably not getting the most from our resources. So what we've agreed to do is to work much more closely together, to understand that we have one pennine pound, and to really try and use the money that we've got to really maximise the benefit for our communities, for our patients, for our residents. So this is difficult. We're trying to break down the way organisations have worked for the last 30 or 40 years, but it's absolutely the right thing to do. And what's really driving it more than anything else is not just about the money, but it's about the workforce. You know, whether you work in social care or whether you work in health, there's real workforce shortages. So by allowing the staff to work together more, by sharing the likes of information, by having similar bases, and by breaking down those barriers, we think we can give a better delivery of services to our residents.
Yeah, because I guess sort of in the past, all health and social care organisations have worked in silos and been by themselves. So obviously it makes sense, doesn't it, for everyone to be working together?
It does, and that silo working we've recognised, and that's been built up by having different budgets, by having different legislation, by having different work contracts. And what we're saying now is, look, that is not sustainable. We need to break that down, and we need to work differently, and we're going to do that.
Great news. Now, we're hearing more and more about national plans to develop what are called rapid diagnostic centres, and you yourself in East Lancashire are going to be one of those centres. Can you tell us, though, what they are and how the Trust will be involved in their development?
So if you think about healthcare is continually evolving and changing. If you think about healthcare now compared to 30 or 40 years ago, it's very different. And one of the things that's been recognised with improved imaging around radiology, CT scanning, pathology, etc., we can diagnose issues much quicker. So really the name is on the tin, rapid diagnostic centres. So when we think that people need diagnostic tests, what we're going to set up on a national basis, and that's going to be certainly the case within East Lancashire, is people can get access to the likes of CT scans, radiology, much quicker, so we can understand what's going on and we can make a diagnosis much quicker, and if there needs to be then more intervention, that can happen. So what we're doing on a national basis is investing much more money in diagnostic kit and some of the cutting edge diagnostic kit, so that people, as I say, can come in, can have their tests quickly, can be diagnosed quickly, and if more treatment is then needed, that can be followed up. And if more treatment isn't needed, we can put people's minds at rest much quicker, rather than having to wait, which in some occasions, days or even weeks for diagnostic imaging.
I'd like to talk now, if we may, about staff sickness levels. And I know it's, not a nice thing to be talking about. It happens nationally that staff sickness levels have risen. You're not an outlier in this. Your staff sickness levels have risen. What I would like to focus on is perhaps the knock-on effect that has on the rest of the staff that are covering in staff sickness, and perhaps for things that may have to be cancelled for patients. My question to you then is, how are you going to manage this rise in sickness levels to make sure that it doesn't sort of progress year on year?
So our sickness levels are higher than we would hope and expect, and I think it's a reflection of the pressure that the system is under at this point in time. We have increasing demand for services, we have more people coming in through A&E, wanting to access all our services, and it's a very pressurised environment in which staff work, and occasionally that spills over into higher sickness rates. We support our staff, and we try and do everything that we can to support our staff, so we look at being very flexible in terms of our rostering and when staff are working. We provide a lot of occupational health, physical health, and also more and more health around sort of mental health and well-being. So we do a lot in terms of trying to support and guide and help staff. But our sickness levels are still too high, and that does have and can have a knock-on effect. So we always try and maintain appropriate staffing levels in wards and departments. To do that, if there are sickness levels that are too high, sometimes we have to go out and what we call use bank and agency staff. So these are temporary staff who will come in with the appropriate qualification and experience, but they're not directly employed by us, and they will cover in wards and departments when necessary.
I guess that's also going to affect you financially.
Absolutely. I mean, there is an additional cost. I mean, the biggest pressure I think that any senior leader in the NHS would say that we all face is workforce, and there are national workforce shortages, particularly in the likes of frail elderly care and A&E care, and staff can therefore expect a premium. So if we have to go out to the bank and agency, there is additional costs that are incurred, and it's very expensive.
I'd like to stay with staff and something that I think is a national scandal, and that is the rise in the number of attacks not only on NHS staff, but those who work in our emergency service. It's never right for those staff to be abused. So how can you, as an organisation, support your staff where they may be physically or verbally abused? It's never acceptable, is it?
It's absolutely never acceptable. Either physical or verbal abuse to staff is absolutely not acceptable. And we will exclude patients and their families from our hospitals and our community centres if we have verbal or physical abuse of our staff. It is simply not acceptable. Staff come to work to do the best job they possibly can in difficult circumstances. The last thing that they deserve is physical or mental abuse. When it does happen, and thankfully it is rare, but it still does happen, and when it does happen, we do everything we can to support staff. So if that's physical care, that will clearly be provided, but more importantly, or just as importantly, it's the mental health and well-being of staff that we always follow up. So we wrap support around staff and their families, both physically and mentally, and we do everything we possibly can. But I would say to anybody, please think about the impact your actions have on our staff. They're there to care for you and for their families and your families and our communities. And so we need to look after our staff. And, they need care and protection as much as anybody else.
So it's interesting, isn't it? My last question to you was about staff sickness. Do you think then that there is a direct correlation between staff sickness and the rise in the number of attacks? Let's face it, the staff, although they do a very superhuman job, they're not superhuman. They are people who have human frailties. Do you think that there is a direct link?
There has to be, doesn't there? And I'm sure that's absolutely the case. And it's not just staff who have been abused themselves, but if you're on a ward and departments and you see another member of staff being physically or verbally abused, that also impacts upon you also, and that can manifest itself in terms of sickness rates. So absolutely there is a correlation between the two.
Got a question in from an elderly lady, and of course we all our contributors remain anonymous, but this lady says, wants me to ask you, do you think that the NHS is a customer service industry? But she follows that up by saying that she's been seen on a number of your wards and departments and found a very different levels of care that she's received from one to another. So she's asking, is it right for there to be such varying levels of care?
So we see hundreds of thousands of patients every year, and you would hope that for every patient there was a very high consistent level of customer care. And absolutely we are a customer care service. Occasionally it doesn't go as well as we would hope, and we need to learn from that, and we pick up on complaints, and if we get the feedback where it's gone wrong, we implement training and we try and learn from what's happened. So yes, the answer to the question is we are a customer service. We recognise that, or we're a customer industry, and we recognise that. Most of the time we'll get it right, but where we don't, we need to learn.
So cleaning now. There is a patient, it's their relatives who've written to me and asked, who monitors the standard of cleanliness in the hospital? In her letter, the lady says, and I'm quoting, she was absolutely disgusted at the state of the stairs opposite the lifts from the ground floor. And she went on to say that these areas were absolutely filthy, and she wonders who is responsible and who checks on cleanliness.
Well, that feedback really does upset me, because we do pride ourselves on the cleanliness of our hospitals, and it's vital that the hospitals are clean. We continually monitor. In fact, we've actually changed over the last few months how we monitor our wards and departments, because we have our supervisors continually placed and walking around the wards and departments, checking to see that the cleanliness is appropriate. So I think we have a good standard of cleanliness, and if there's any instance where staff or patients don't think it is, that feedback is really important, and we will have extra vigilance on that staircase by the lifts. But I mean, Rush, you know this yourself. I mean, you undertake place visits which look at things such as cleanliness in the hospital, and generally we get really good compliments and feedback about the hospital and how clean it is.
Yeah, I think I can say that cleanliness was actually one of the areas that improved last year as well.
It did, absolutely improved. And it is something that's really, really important to us, because the very least people can expect is a clean, tidy hospital. So if it's not happening, we need to be extra vigilant, and I can assure your viewers and listeners that we will do.
Should we perhaps suggest that if someone recognises that there's something that needs reporting, to actually report that up to a member of staff?
Absolutely, and you can take it through PALS, or you could take it through the main entrance where we have the reception. Please let us know if there's something that's or a piece of the hospital that's not as clean as it should be. Let us know, and we will get it cleaned immediately.
Okay, thanks for that. Let's talk about money. Always cheers me up. The government's announced a £1.8 billion fund to improve hospitals. My question to you, is it enough? Are we going to see any of that money here in East Lancashire?
Well, it's never enough, is it? And we can always spend more money. I think it's too early to say yet whether we're going to get any of that money, although I'm hopeful that we will see some. In the first tranche, there was 20 areas that were identified for additional funding, and nowhere in Lancashire was in that first 20. But I am hopeful we'll get something of the additional monies.
A&E and the trust, like every other trust across the country, is still missing its 4-hour target. How are your improvements going in your emergency departments, and when can patients expect them to be finished?
So you're right. This summer we've seen more activity, not just within this hospital but nationwide, than ever. So the numbers continue to increase. We used to talk about winter pressures in A&E. We now talk about all year round pressures. And as I said, this summer has seen some of the highest numbers ever through accident and emergency departments, both here and on a national basis. What I can say is, we've been very lucky. We've got an additional up to £12 million that we are investing in our A&E frontline emergency services. And if anybody's been to the hospital recently, you will see on part of the car park next to A&E, it's been fenced off and the diggers are there, and we're putting a new build that will give us an expansion to our emergency flow and our emergency services within the hospital. Unfortunately, they won't be ready because it's a big build. It's 12 million plus. They will not be ready until around about September of next year. But that will really help our capacity and help us to be able to deal with the increased number of people that we're seeing in the hospital.
I guess the obvious follow-on question would be, is that build going to affect your ability to provide care this year towards the end? Because, of course, we're coming into winter pressures, aren't we?
Yeah. So we do everything we can to manage through winter. We're looking at additional staff. We're looking if there's any areas where we can open additional capacity. But, of course, a lot of this will depend upon what happens this winter. So, for instance, if nationally we get a very bad outbreak of influenza, then I think the whole of the NHS is going to be under pressure. So, we have to monitor it very carefully. We are planning very thoroughly for this winter. We are looking at additional staffing, additional capacity. But if you go back to what I was saying before, staffing and staff shortages is a national problem within the NHS, and therefore there's only so much that we can do in terms of opening up that additional capacity.
Are you currently fully staffed, or are you, like other hospitals, struggling to get those staff?
I mean, we always have vacancies, so we always have a certain element of nursing vacancies and medical vacancies, and we're no different to any other trust in the country. We're working very hard to try and fill them. We have continuous rolling recruitment, and we do everything we can. But yes, there are some gaps in staffing, and I can't see them being closed in the immediate future.
Kevin, do you see the future of care being moved more into the community, which is what patients are telling me that they want? And if so, how are you going to enable that?
I think that's absolutely the case. So hospitals can't continue just to absorb more and more and more activity. What we need to be able to do is work within our communities and with our communities so that we keep people fitter, healthier, more resilient in their own homes and in community facilities. So we're working very closely with GPs and primary care, with our community services. We've got medical staff and nursing staff in the hospitals reaching out into communities to put more resources and more staffing into communities. So absolutely, whether it be it around health centres or community centres, we need to wrap services in those locations so that people don't have to come into hospital. And only then when they need hospital do they come into hospital, and then the services need to be world class. But this push for out of hospital care is absolutely the right thing to do.
You recently highlighted in one of your blogs the current problems around the pensions, tapered allowances and tax, and the impact that that's having on many of your staff and obviously therefore patients. How is your trust addressing and supporting staff with this huge problem?
So this is a huge national problem. What we found, because of the way the pensions have been set, is that because of the staff shortages that we've had, staff have been doing additional sessions, working overtime, coming in at weekends, and clearly we have to pay staff for that. But what a lot of staff have now found, particularly medical staff, is because of the way the pensions have set, they're actually getting penalised financially for doing so. So it's not in their interest to come in and do the additional sessions, which means we lose some capacity, which means we can't keep on top of things such as waiting lists. So we are looking at that, but what we're very clear about is we can't do something in isolation. This is a national problem. This is has to be solved through the Treasury, through the Department of Health, and we have to abide by national rules around taxation, and we will do so. So whilst we're very sympathetic about this, we can't do something in isolation, and we're working with, if you like, all other NHS trusts to try and help the Treasury and support the Treasury to come out with ways by which we can fix this.
And let's hope the government recognises and does something about it very quickly.
I hope so.
You've got over 8,000 staff, so you're probably one of the largest, if not the largest, employer in the area. But recently you took on a four-legged member of staff. Can you tell us about Jasper, the therapy dog, and his role at the Trust?
Jasper is wonderful. If anybody's seen him walking about, he's a wonderful therapy dog. And I know by seeing the impact that therapy dogs have on patients and on families and on staff, how much joy he brings into the organisation. So you will see Jasper walking around the organisation. He'll have a bright yellow bib on, so you'll be able to recognise him. And if you see him, stop him. He loves being patted. He loves being looked after and appreciated. And the joy that he brings to our staff and to our patients is wonderful.
Now, not only are you the Chief Executive of East Lancashire Hospitals Trust, you're also the Interim Chief Executive at Blackpool Teaching Hospitals Trust. How is that going, first of all? And a few people are rather alarmed that you might be leaving. Are you?
So absolutely not. In terms of leaving, I can categorically say that it's my intention and wish to continue working at East Lancashire Hospitals Trust. So that's not the case. But they did have a vacancy for a chief exec over in Blackpool, and they were going through a very, very busy time, and I agreed with the support of the hospital here and the board here that I would cover for a period of time the role in Blackpool. Now, what I can say is actually I think that's had benefits both for Blackpool but also for East Lancashire, because there's clinical networks and clinical services, and the hospitals can support one another in different ways. I talked about staffing vacancies that we have in gaps. Well, hospitals can help one another with those gaps. So I think it's paying benefits to both organisations having one joint CEO for the time being. Whether that's the case for the future, who knows? What I've agreed to do is to cover it on a short-term basis, and then we'll go from there.
I seem to remember reading that you were originally going to be there until October. Has that changed?
That's the plan till October, but it's currently being reviewed.
Okay. Well, It's that time, Kevin, where I give you the opportunity to tell me and the rest of our listeners and viewers what your reasons to be cheerful are this month. So, Kevin McGee, what are your reasons to be cheerful this month?
So two things. We've just gone through another birthday for the NHS, so it's now our 71st birthday. And I think the fact that the NHS is still here providing high-class, world-class services is absolutely a reason to be cheerful. And then the other reason to celebrate and to be happy is, as I said, we were in the process of developing a new significant expansion to our emergency service, and that will be world-class facilities delivered in Blackburn for the residents of East Lancashire.
Kevin McGee, Chief Executive of East Lancashire Hospitals Trust, thank you for your time and thank your staff for their care. Thank you.
Thank you, Russ, and can I take this opportunity to thank all our staff for the brilliant work that they do.
Well, whether we like it or not, we're all getting old, including me, and the ageing population is certainly a major factor when it comes to the strain on our NHS, and it's one that all healthcare systems in the world are struggling with. Medical advances have meant that people are living longer. When the NHS was created, life expectancy was 13 years shorter than it was now. Can you believe that? Well, of course, that's something to celebrate. Infectious diseases are no longer a significant threat. Heart attacks don't claim the lives of people early in the same numbers, and even cancer isn't the death sentence that it once was. Half the people now survive for 10 years or longer. But this has come at a cost to us all. People are living with a growing number of long-term chronic health conditions, diabetes, heart disease and dementia, to name but a few. And these illnesses are more about care than cure. And what those patients need is support. By the age of 65, most people will have at least one of those illnesses, and by the age of 75, they will have two. It's quite a sobering thought, isn't it? If you'd like to submit a question for the Trust or for its Chief Executive, Mr. McGee, please do drop us a line at the end of this presentation. Thank you.